Hey guys, this is Dr. Hub. Today we'll look at the AML. AML stands for the acute myeloid leukemias. So under the AML, we are going to look at the prognosis. So just sticking to the prognosis. So first, let's focus on the good prognosis. So under the good prognosis, this is when the age is greater than 40 years. It is not greater, it is less. So age is less than 40 years. And the M2, M3 and the M4, they form the AML. Then in case the TLC is less than 25 into 10 to the power 9 per liter. Then also the blast cell with the all rods. Blast cell with the all rods. Next is the good prognosis. It involves the T. So there's T 8 to 21, and there is also the run X1, the ETO fusion gene. Then comes the T 1616 or the inverse 16. There is CBF1 or the MYH1 fusion gene. So these are some good prognosis. Then there is also the rapid response to therapy. Rapid response to the therapy. Then there is also involvement of the leukemia. There is leukemia and there is leukemia without the prescribing. So leukemia without the presiding the MDS, without presiding the MDS. Then there is the presence of the normal karyotyping. There is normal karyotyping, and this is the mutated NPM. Then there is also presence of a biallelic mutation. This presence of the biallelic mutation, and this is in the CEBPA. Next, we'll move on to the poor prognosis. So as per the poor prognosis, this is when the age is less than 2 years or greater than 55 years. So age is less than 2 years or greater than 55 years. So then what is the forms? So forms in poor prognosis, it involves M0, M6, M7, and they are the forms of the AML. Then there is also the TLC. So TLC is greater than 100, and this is into 10 to the power 9 per liter. Then comes the deletions. The deletion is nothing but 5q, 7q as well as 20q. So what are the genes which are having poor prognosis? There is T11, Q23, and this is with diverse MLL, fusion genes. This is diverse MLL fusion genes. And there is also T6 and 9 and inversion of 3. Then other points in poor prognosis, they contain delayed response to therapy. There is a delayed response to the therapy, as well as there is presence of AML. There is AML, and this is preceding. There is preceding MDS, AML with preceding MDS, or the anti-cancer. There is anti-cancer drug exposure. There is anti-cancer drug exposure. And there is also the complex karyotypes. There's complex karyotypes, and also the activating mutation. There's activating mutation, and this is of the FTL3.